Again, for you, Bnar, they're addressing you in this one. So, hi, Bnar. Is there any evidence to suggest people who have received the vaccine are still able to pass the virus on to others? How important is it to continue to follow the current advice on maintaining social distance, washing hands, and wearing face masks in public after vaccination? So that's from Tom. Thank you very much.
Thank you, Tom, for that. Very, very good question again. So what we know about the vaccines is that they provide very good protection, actually better protection than most other vaccines that we routinely use. They provide about up to 94, 95% protection versus the flu vaccine, which only gives you 50% protection. And even then, the flu vaccine has been shown to save many lives. So that's really good. What does that protection actually mean? It means that if you take 100 people who've had the vaccine and you expose them all to COVID, 94 or 95 won't get the virus. The 4 or 5 or 5 or 6 that do get the virus, even though they've had the vaccine, will have a very mild illness. So you've guaranteed that no one's going to end up in hospital and no one's going to die from it. But most of them won't get the virus, and the few that do still get the virus either won't know it because they don't have symptoms, or they'll have really mild symptoms. But we don't know which of those people that will be. And so that's why it's really important to keep following the guidance, because we don't know, once you've had your vaccine, you take 2 weeks to develop your immune system to give you that protection, so can catch it before then. After the 2 weeks, you can still get it, but your risk of catching it is very, very low. And even if you have it, you might not know it, but you can pass it on. And you can pass it on to someone who hasn't had the vaccine. And that's why I keep talking about this 80% people have to have both doses to get the protection. Because what will happen is, as we're vaccinating more and more, the restrictions are going to be eased off very slowly to see what impact that has on spreading. But nothing will go back to normal until we have 80% of the population having both doses. That means the risk of spread will be so low that the vaccine will do the job of doing what it's supposed to do, which is to protect us.
Yeah, that's really important. Sorry, was anyone saying anything? So I think that might have been a thing.
I would just echo the fact that, yeah, once you've had the vaccine, to still do space replace and ventilate, so make sure that you still follow full social distancing guidelines, because it does take 2 weeks for it to build up a level of decent immunity. And also, it could be on you, and even though you're not feeling the symptoms because the vaccine has worked and you've got an immune system, you don't want to potentially pass it on to somebody who's not had the vaccine.
Yeah, that's really, really important there as well. And just a reminder, it's important in our religion to stay our hygiene. So guys, we definitely got to keep washing our hands. Yeah. So even if you had the vaccine, keep washing your hands, keeping your distance. Because it's going to take some time. So yeah, let's not slack on this one. Yeah. So we got more questions.